little bit of your background, kind of your qualifications as an expert?
Sure. So I'm a family physician and did training in preventive medicine as well. And I'm an assistant clinical professor at the WSU College of Medicine. And so part of my work is working with community organizations to try to improve the health in the community as a community partner with the university. And so we're a member of Better Health Together, and are joining the fluoridation efforts through Better Health
Awesome.
Together.
Awesome. So kind of like alluded to, the big question we'd like to answer for viewers who are hearing about this proposal for the first time again, what are the health benefits to increasing the city's level of fluoride in our drinking water?
Yeah, so what we know is that fluoridation is one of the top 10 public health benefits of the last century. And so really community water fluoridation is up there with seatbelts and safer car designs for improving the health of the public. The other thing we know from preventive medicine is that it's much better to provide everything with everybody with an engineered safety issue than to try to have every individual person do it. So designing a safer car is much better than asking everyone to wear their seatbelt every time, every day. And the same thing with fluoride. It's much better for that to be in the water supply, and then instead of having to ask every parent to take their kid to the dentist, to take them to the primary care center to get that fluoride treatment, that fluoride varnish. It's also much cheaper.
Can fluoride be poisonous?
So fluoride is a naturally occurring element and is actually part of building a healthy enamel in the teeth. So fluoride is not a toxin in the sense that we generally think of poisons. It's more in the idea of too much of anything can be a bad thing, including water. Um, but the fluoride levels in the water is not toxic at all and is actually health beneficial.
Hmm. And that increase in the proposal, so currently Spokane's drinking water is at about 0.1 milligrams per liter of fluoride, and the proposal looks like wants to up that level to 0.7, that federal recommendation. Seems like not a huge increase, but maybe it is. I guess, could you kind of explain that?
Sure. So in communities that have fluoridated water, we see less problems with teeth in children, and that segues into, as an adult, it's easier to get work, it's less expensive to require more dental care in the future. So there are all sorts of benefits that follow from having that fluoridation level at zero point 0.7. And that zero point 0.7 level was determined through really decades and decades of observational studies of finding a safe value. So in the same way that we have a daily recommended value for vitamin C or vitamin B, there's a benefit for fluoride to the teeth.
Why do you think it's taken the city of Spokane so long to increase those levels?
Well, I think people are concerned about having something done to everyone at times, and that's a reasonable concern. And they want to have, you know, want to have a say or control in that work. But water fluoridation really has been shown to be a public health benefit. And if you look at nearby communities like Cheney, they have water fluoridation, which is improving their care. So it's worth noting that there was a backlash to seatbelts when they were first introduced. There was a backlash to airbags. And so, people are sometimes anxious or suspicious of change, and that's reasonable to be skeptical, but the evidence is clearly for decades shown the benefit of fluoride.
And did I hear you correctly? Cheney is one of our local cities nearby that have increased the levels, and they're already seeing improvement in their dental health.
Yeah, my understanding is they have a fluoridated water supply.
How long has that been in place? Do you know?
I don't.
Oh, okay. All right. I think that hits it on the head. Answer all my questions. Is there anything else that you'd like to add on that note?
I think the only thing to add is that because we don't have a fluoridated water supply, we have to find workarounds to get fluoride on the teeth because we know how beneficial it is. And the number one way that we do that really is kids in school. And if we are going to online or there's likely disruptions in kids' ability to go to online school, then fluoridation, getting that dental varnish on their teeth is one of the things that will probably fall through the cracks. Many dental offices are closed for anything except essential services or emergency needs. And so that's another way in which kids won't have good access. And so we're looking at lots of ways in which uh, the level of fluoridation available to kids is going to go down, and that makes fluoridating the water even more important.
Oh, that's a great point. Definitely, a lot of unexpected changes with all of COVID's effects there. Yeah. Well, thank you so much again for making the time to chat with